thank you all for being here or tuning in today. Today we are holding a special press conference to talk about the Delta variant, what it is doing across the nation and what we are seeing here in Kentucky. Some top lines that you're going to hear during both my and Dr. Stack's presentation. The Delta variant is serious, and it is even a deadly threat to non-vaccinated Kentuckians. Vaccines are still offering significant protection against serious illness and death, including against the Delta variant. But we are seeing more cases among vaccinated Kentuckians because of the Delta variant. We're going to give some recommendations, what we strongly encourage people or groups to do as far as masking given the Delta variant, but to end, one solution to all of it: get vaccinated. Get vaccinated to protect yourself, get vaccinated to protect the people around you, get vaccinated so we can defeat COVID once and for all. And before I get into the full substance, I do want to note, and it's the one note outside of what the press conference we're having today is on, that we've lost a number of individuals here in Kentucky, including in our state legislature since the last time I had the opportunity to address you. They include Representative Pam Carney and Senator Tom Buford. We believe this Thursday we'll be flying our flags here at the Capitol at half staff to honor their commitments and to express our sorrow. We lost David Hopp either last night or this morning, someone that I knew personally who contributed so much to journalism here in Kentucky. And we here in the executive branch lost one of our social workers for CHFS, Crystal Willis, in a car accident this weekend. We are thinking about all of them. So to set the stage in our discussion on where we are in fighting COVID and the Delta variant, let's first go over where we are in terms of vaccinations. There's going to be news today that is concerning about the Delta variant, but that shouldn't take away what I believe has thus far been a very strong vaccination effort. That sure, we have to do more, and we're going to talk today about the reasons we have to do more. James, let's put up the overall overview slide. No, let's do, James. Oh, sorry, we're doing, let's do this one. We have Kenneth back, but he's not in here. So to give you the overall count of where we are, we've now administered more than 4.1 million doses. That's not it either, of the vaccine here in Kentucky. That's it. We have vaccinated 2,248,235 persons in Kentucky. But if you take the net in about people who are vaccinated out of state that are Kentuckians, minus the number of people out of state that we have vaccinated, we believe our number of vaccinated Kentuckians as of today is 2,259,455. Over the weekend, we had a number of vaccination numbers come in. It could have been done before the weekend, but we think over the weekend about 20,000 additional Kentuckians were vaccinated, but that would be included in that number. So a couple things to see here, which we're going to go over. A couple of our good numbers: 65 and up, we're over 83% vaccinated. We believe that CDC has that number around 86. I hope their number is right. We want to continue to see this to grow, but these continue to be the most vulnerable Kentuckians out there, though this vaccine is absolutely protecting that group and every other from serious illness and death, even when it comes to the Delta variant. But then when we look at Kentuckians 50 years and older, we're also seeing good numbers. Yes, we want to improve them, but over that 70% number, that certainly is one that we want to shoot for. Couple other data points. This last week, 32,631 Kentuckians vaccinated, that's up significantly from the 4th of July weekend, which I know is a tough comparison, but overall 32,000 a week. If we could continue to see that is something we will take, but again, would like to improve upon. And 12 to 17-year-olds, we're going to look at this a little bit later. We've been counting that up. Now 86,510 Kentuckians, 12 to 17, have received their vaccinations. Now, the next set of slides I want to walk through show, I believe, our vulnerability based on age group, as well as areas of the state as we look at what the Delta variant could do and where it would hit. So let's go to the first one that you put up. This is, again, the total number of vaccinations we have given. That doesn't include the out-of-state folks that have been vaccinated that are Kentuckians. Let's do this for a minute by age group. Can we hit the first? So this is our overall 18 years and older. This is originally who was eligible for most of the vaccines. 61%, again, want to improve, but this is better than many of our neighbors. It is better than places right now that are seeing the hardest hit from the Delta variant, though we will show you that we are seeing it too. All right, so 65 years and up, again, we talked about this earlier, over 83% of Kentuckians that age and up having been vaccinated. We want to continue to fight for that to climb higher, but as we look through our data, that's one number we're pretty proud of. We think is a good number. Again, the other 17% we want to find. We want to give you the right information. We want you to make the right choice to get vaccinated. 50 years and up, again, over 60%. At 65%, and as we showed you a little bit earlier, if you make that just a little bit older, the numbers continue to increase. So these are our two age demographics where we think we are doing fairly well, though need to do better, but offer a significant amount of protection. Let's go to the next one. So ages 40 to 49 years is an area where we have seen some growth is not enough. I fall in this group. What we'll talk about when we reach the Delta variant is a lot of people in this age group are ending up in the hospital, and some of them never make it out. So from the original COVID strain that was out there, if you caught it and you were between the ages of 40 to 49, your odds were pretty good that you were eventually going to be okay, even if it was a rough go. That wasn't the case for everybody. But when you looked at the numbers, it's very different for the Delta variant, and a 50% vaccination rate amongst this group is not enough for what we're facing. Let's look at the next age group. As we can see, once we dip to below 40, our vaccination rates are all below 50%. What this does is, again, it exposes this age group to this variant that can be more deadly, cause serious illness in younger individuals. And it means there are more people, especially in this age group, that can spread it to each other and amongst others. Let's go to 18 to 29. We have a 10% drop even from the 30 to 39-year-olds. When we hit this age group, we need to do a lot better, just barely over a third. And folks, these are adults, right? These are adults. We need them to make the adult decision, the responsible decision to get vaccinated. And then we look at 12 to 17-year-olds. We've explained in the past that the census numbers are really tough when it comes to 12 to 17, but we know we don't have nearly enough of that group vaccinated. We're sure that percentage is below that 36%. We're still working to make sure we can have some accurate numbers to show. So when we look at the Delta variant, what is our risk? I could tell you from the incident rate today, 65 and up is low. It's the lowest incident rate out of any of the age groups we have. Why? Because vaccines work. They at least prevent serious illness. But then what you see is, especially as you get in the red and the 18 to the 49, we see our highest incident rates, and we have been each day. So when we look at our weaknesses right now, when faced with the Delta variant, it is needing to get Kentuckians 12 to 49, but especially 12 to 39 vaccinated. You can help us beat this thing. You can help us get back to a full normal. You can stop seeing me do these, whichever one motivates you, if you go out and get vaccinated. So that's an age group that shows some of our vulnerabilities. Let's look geographically. So first, let's start with Kentucky counties with less than 50% of their population vaccinated. As you can see, this is about half the state. This is, if you run into somebody, because right now, nobody's really wearing masks except those that opt to do it, and we're going to talk about our recommendations. 50% shot that anybody you're talking to in any of these red counties is unvaccinated, which means that, as you will see, that it's what Scott Gottlieb, who was I believe the FDA commissioner under President Trump, says is if you haven't gotten vaccinated and you haven't had COVID, you're gonna get the Delta variant. And this shows you how much of the state, if we take a 50% mark, could be at risk. But let's do more than that. Let's take it a step down. If this is concerning, where is it really concerning? These are counties with less than 40% of their population vaccinated, meaning that it's more likely than not that the person that you run into is unvaccinated, putting them at high risk for the Delta variant, which obviously can spread and spread quickly. So our areas of concern where the Delta variant can hit and where we're worried about is both in certain age groups demographically as well as regionally. And these, and Dr. Stack will be able to basically show you in different ways with the United States map where you see the least amount of vaccinations or where you see the most cases of the Delta variant. So let's look at where we are on cases here in Kentucky, and this is a direct result of the Delta variant. Let's look at our typical stair-stepper chart. All right, so we've looked at this now for almost the entirety of our battle with COVID. Multiple times we have seen concerning trends. Multiple times we've plateaued. Then we had one of the most difficult times in our history over the winter, where we lost so many people. And then we saw major decreases in cases after vaccines came out. Cases almost fell off a cliff. They stabilized a little bit. We got even more people vaccinated, and they continued to decrease. That is until 3 weeks ago. We have now had 3 straight weeks of increasing cases. And the rate of that increase is also increasing. And we'll talk about the positivity rate, which it's happening to as well. So let's show the last 4 weeks to get a full baseline of the 3 weeks of increase. All right, so what this does is this graphically shows you both the increase week to week as well as the severity of the increase. Remember when we talked about growth versus exponential growth and how we didn't want to see, if you'll go back to the previous chart for just a second. When we hit we saw a pretty significant increase in the summer, if we remember when we faced it, and then a little bit in the fall and in the winter. That's when the curve, almost became vertical. It was increasing so quickly. Our curve is fairly significant, while the cases are so much lower than they've been right now. If you'll again go back to this next chart that we were looking at, and one way to look at how much that increase is how the line really from the June 14th to June 20th, and if we had one, to the next one, it's just a little bit up, and then it's a little bit more, and now we're seeing again significant growth week to week. We're seeing the same in our positivity rate. Our positivity rate had plummeted to levels that we had prayed for. Let's look at the overall chart first, if we have it. Getting down to below 1%. at different times. Today, I believe we're at 5.45% on today's positivity rate. We can stay here. That is a significant increase. This chart has the end of last week, which is 5.12. Today, it is higher than that. Now, one thing that is increasing, but not necessarily increasing at this rate, we're seeing an increase in hospitalizations, but we are not seeing an increase of the same magnitude in hospitalization, ICU, or deaths. Now remember, all of those follow cases, and so we don't yet know what we'll see on that. Now, you could extrapolate from what we're seeing across the United States that some of these are breakthrough cases with people that have been vaccinated, and they're very unlikely to be hospitalized. They're even less likely, if they are, to end up in the ICU or to have the worst outcome. So I do believe we are going to see a difference in the numbers as they jump from cases to those others that we did in the past. But folks, it's entirely avoidable, which it wasn't in the past. The hospitalization numbers, the death numbers, the ICU numbers are totally avoidable if you get vaccinated. Let's show case incident rates among vaccinated versus unvaccinated individuals by week. And Dr. Stack is going to go over this in more detail when it comes up. It's the line chart. We have a lot of graphs today. So as you can see, with the rise of the Delta variant, the cases, non-breakthrough cases, are unvaccinated individuals. That's what we should have put on because it can't break through if you're unvaccinated. Look at how steep the increase is versus where it was really before the Delta variant became the dominant strain. And as you'll see, vaccinated individuals still significantly protected. But we are seeing more breakthrough, and there could be a number of explanations for that. There's also more exposure. If there are more unvaccinated people who have the virus that you could come in contact with. So take whatever percentage they'll come up with for the Delta variant that vaccinated individuals could get a breakthrough case, but the more unvaccinated individuals with the Delta variant you come in contact with, the more often that you roll the dice on whether or not you might contract it. One other that I want to show, because I have both a 12-year-old and an 11-year-old, meaning I have a 12-year-old that I've been able to get vaccinated, and I have an 11-year-old where I am waiting every single day to learn when she can get vaccinated, is what we're seeing here. Individuals under 12 can't get vaccinated, and let's make sure that we break through a myth. Kids can get COVID. They do get COVID, and they're contracting COVID at basically the same rate, or generally the same curve at least, as all other unvaccinated Kentuckians. All right, the next one that we were going to look at briefly, the rate of COVID-19 cases and vaccinations. I'm going to let Dr. Stack go over that one. He's got it more in depth. So why are we seeing what we're seeing? It's that we have the most aggressive variant that we have seen to date in our battle against COVID. It's more aggressive both in terms, we believe, of spreading, the viral load it creates in each individual, which adds to the spread. It's more aggressive in how it's able to break through to vaccinated individuals, even though you are still very much protected from harm. It's also the most aggressive, it appears, in putting individuals in the hospital. And we think it may be more fatal than the other variants that we have seen. Now, we could easily say that it puts more younger people in the hospital, which it does, but more older people are protected when we look at it. So because they've been vaccinated at a higher rate. So this is one that can be deadly to just about anybody. I want to talk a little bit about what the former FDA commissioner, Scott Gottlieb, said the other day. I want to point out that this is the FDA commissioner under the last president. We have never brought politics in to what we do. We want to make sure that we've got experts that hopefully cross any party, administration, etc., because they're all saying the same thing. So what Scott Gottlieb has said is that if you're not vaccinated and you haven't had COVID, meaning you don't have some level of natural immunity or protection, you should expect to get the Delta variant, and you should expect it to be the most serious illness that you will ever have in your life. Think about that. This is a former FDA commissioner, right? He's we would say in my generation, pretty legit if you were in that position. He knows what he's talking about, and what he's telling you is if you're not vaccinated, you are going to have the most serious illness of your life. And you can make a very easy decision to never have that illness. It's just about going to your local drugstore or your doctor or your grocery store or your local health department, or you pick. We'll send a vaccine there too, and getting vaccinated. So next is, we are seeing a rise in Kentucky. We are not yet at the point that so many other states have gotten, and this is the unvaccinated states feeling the brunt. And the reason that we haven't is that we have done a better job than many states at getting individuals vaccinated. But it's just starting at the least amount of individuals vaccinated and those regions. And we are starting to see the uptick now as well. We can avoid what a lot of these states or areas have seen, again, by getting vaccinated. And we would expect this same trend of the most cases or the surge happening in states with the least amount of vaccination. Also in our own state, we would expect to see it in regions with the least amount of vaccination. And the next piece is about what we would expect in terms of kids. This is a hard one for me to look at, but this is another thing that they're discussing, that younger children, especially those that can't get vaccinated yet, are going to end up seeing fewer opportunities or having to go through more things to have opportunities than the rest of us if we don't get vaccinated. So who ends up paying? It's not just adults. It's those amongst us that count on us to make good decisions and to do the right thing. Again, with the next slide, I want to reinforce that the Delta variant is causing more difficult, deadly, tragic outcomes among younger people, including children, than we have seen in any of the traditional or variant strains to date. And the final thing that I will mention before turning it over to Dr. Stack is, with a variant like this, we are now seeing the return of clusters. Remember, especially in the beginning of COVID, we would talk about how we would see a case rapidly spread through events, through a place where people were inside together, through gatherings. These are a couple that are happening nationally, but let me show you just a little bit of what we have seen since May 31st here in Kentucky. We have seen 34, if we can bring up the chart, 34 clusters. That is, again, this is just based on information we receive from local health departments, so we know that there are many more that have accounted for over 335 cases. It appears that the amount of clusters that we're identifying are increasing. You would expect that with the cases. But again, we're seeing where one individual, and folks, most of these stories start with unvaccinated individuals, test positive, spreading it to other unvaccinated individuals, and then some smaller level of vaccinated individuals. And in almost every one of these, some certain amount of the unvaccinated individuals have a very serious illness, and a very small portion of vaccinated individuals even show symptoms. But we are seeing the return of clusters, and we've seen that, I think, nationally. You're seeing it. The Yankees had to cancel a game the other day. There's big concern about the Olympics as well. So I want to throw out some recommendations, which we have made some of that we are making today, that we are strongly encouraging all Kentuckians to follow. Some of these are expected. One is a little bit newer. So, number one, we've been saying this, but with the Delta variant, it needs to be followed. All unvaccinated Kentuckians, you have to be wearing a mask when you're outside your home and you're indoors with people you don't live with. This isn't just the COVID from before. It is a deadlier strain. And again, if you haven't had COVID and you won't get vaccinated, the experts say you're going to get it and it's going to be the most serious illness of your life. We know that wearing a mask works. This spreads the same way as all the other strains. Wear a mask. If you don't want to get vaccinated, again, I'd really love to talk to you about that, or you to talk to your doctor about that. If you're unwilling to do it, wear a mask. Second, Kentuckians that are at higher risk due to pre-existing conditions. We talked about this earlier. We believe that you should also be wearing a mask at this point, even if you are vaccinated. This means that you have significant heart, lung, kidney issues if you are immunocompromised. At this point, given that we have seen an increase in breakthrough cases, we want you to be protected, even if this is out of an abundance of caution. We think we have seen enough data to make this recommendation. Here's another one. Vaccinated Kentuckians with jobs where you are exposed to a ton of people each day. If you work in hospitality, if you work in a restaurant, if you work in retail, and there are many more. I'm not picking on any industry, just where the individuals come in contact with a lot of people. We are recommending at this point that you wear a mask. Whatever, and we'll learn at some point what it is, the likelihood of a breakthrough is for a vaccinated person. The more people you come in contact with, the more exposure you are likely to have. And so we believe that it is at this point a smart idea. But the overall recommendation, and if people would follow it, the only one we'd need is if you're not vaccinated, get vaccinated immediately. Again, you can see the curve of the cases we have. This is all it would take to protect America if folks would do it. Protect all of us, every single one of us, from serious illness and disease. Protect all of our communities. Let us do everything that we enjoy doing. The solution is really easy. It comes in 2 shots or 1 if you want to get the one, but you really need to get it. All right, I'm going to turn it over to Dr. Stack. Then we'll take questions.
Thank you, Governor. Good afternoon, everyone. James, do you have my slides there, please? Thanks. I'm going to use some of the same images that the Governor used. I'm going to tell a little bit different stories to complement the information that he provided. And I also, of course, want to do a little bit of the science that we talk about to try to make it more accessible. So the Governor had showed before slides that showed how many people in Kentucky have been vaccinated. So it's about 2.25 million Kentuckians so far. It's about 51% of our population. That's really good. It's also not enough. And so I'm going to use 2 slides from the World Health Organization that they released last week to help make these points. So the first one here shows how we measure vaccine effectiveness or efficacy when we do trials. So you have a placebo group that's unvaccinated, and you have a trial group that gets the vaccine. What you're looking for is when you vaccinate the folks with the new treatment, you want to see, is the disease less common in the people you vaccinate. So in this graphic here on the top, it shows a large group of people, and it shows 10 to the far right who are all red. Those are folks who are unvaccinated who become infected. The group on the bottom is a large group of people, all of whom are vaccinated. It shows 10 people to the far right, and it shows that when they were vaccinated, 80% of them, or 8 out of 10, were protected from the disease, and only 2 turn red, 2 get infected. That would mean that's 80% effective, or an 80% efficacy. When you translate this to a larger community of people, you talk about relative risk reduction, that the unvaccinated have a higher risk relative to the people who are vaccinated. I'm going to come back to this and show Kentucky data to make this point in real time. The next slide, please, James. This shows the other way vaccines protect people. So the first slide showed how a vaccinated person is safer than an unvaccinated person at the individual level. this shows how at the community level vaccination protects us all. The individual to the far left is the first infected person. We would call that the index patient. That individual contacts the two people immediately on your slide to the right. Those individuals up to the top, he immediately encounters an unvaccinated person who then encounters a person who is vaccinated, the blue folks. And then because there are more vaccinated people behind them, it essentially buffers or stops the disease from transmitting. So the World Health Organization describes that as breaking the chains of transmission. Because the viral load in the first person who was vaccinated and who became infected, because some people who are vaccinated can become infected, but because the vaccine probably lowered their viral load, and then they encountered people who were vaccinated, there was not enough transmission of virus to continue the chains of transmission. And you've got two people off further to the right at the top there who are unvaccinated but never get infected because they never get exposed to the virus. The difference in the bottom is where you have very few people vaccinated. And here what happens is you have a long chain of 1, 2, 3, 4, 5, 6, 7 people in a row who all pass the infection to each other because they are unvaccinated, and the one person in the middle who's vaccinated who doesn't get the disease. So when more of us get vaccinated, not only do we protect ourselves at the individual level, but we protect the entire community overall. If we show the next slide, this is going to show in real time this effect happening in Kentucky. So the line across the top is the vaccination rate at the start of the calendar month. So early July, we have 51% or close to 51% of Kentuckians vaccinated. The gray bar graphs are unvaccinated people, and it's the rate per 10,000 people who get infected. So on the far left over there, when we go all the way back to March, we had 45.7 people per 10,000 Kentuckians who were infected. That was compared to only 11 per 10,000 people who were vaccinated in the blue bars. So those two effects, I said, relative protection, vaccinated versus unvaccinated. Here on the left in the gray bars, you see a much higher proportion of unvaccinated people get infected out of population size of 10,000 people compared to the vaccinated population where a much lower rate is. So the rate goes anywhere from 4 to 8 times risk reduction. So the other effect you were seeing for March and April and May and June was that as the number of people who were getting infected overall was decreasing, the entire community had a lower rate. And so that's how we went down to the lowest rates in forever that we'd really seen since last spring for our overall COVID new cases. The far right in July shows what happens when you have a new strain that's more weaponized, more effective in spreading itself between people. The Delta variant may be 2.5 times more transmissible compared to some of the other variants. And what's happening now is it's spreading like wildfire, particularly in the unvaccinated population. And so you see an almost doubling from June to the first 2 weeks of July in those gray bars, from about 18 to 35 for the rate per 10,000 people. On the right hand to that, the blue lines, you see a doubling also in the vaccinated population, but there's still a 6-fold risk reduction both in June and in July. The point is, vaccines protect people from getting infected, not 100%, but really profoundly in a 6-to-1 ratio in the most recent data sets we have in Kentucky. And additionally, this is just cases. This is just getting infected. We know that the protection is far better when it comes to death and severe disease. So now, really, this is a vaccine manageable condition. Every death that occurs from this point forward, unless we get new strains even beyond the Delta, is probably a preventable death from COVID if they were just vaccinated. Next slide, please, James. So what we have happening now in states like Missouri, which has been in the news a lot recently, they have a relatively lower rate of vaccination overall, and they have very uneven vaccination. So most of the state geographically is unvaccinated or relatively low rates. And it's only a small number of areas with larger population centers that have higher vaccination rates. And so in this small community in Springfield County, Kentucky, that's the quote there from the newspaper and from the fire chief, talking about a dramatic increase in deaths in that county and in that community, and all but one of them occurred since late June in unvaccinated persons. I say this, again, because getting vaccinated is a choice. We have said that all along. It's your choice. It's an incredibly important choice. It's a choice that should you choose to get vaccinated, you protect yourself and you also protect all the others who are both vaccinated and unvaccinated, because the more of us who are vaccinated, the less haven the virus has to spread, to infect people, and to hurt people. If you choose not to get vaccinated, that is your choice as well, but it is a particularly dangerous choice, both for those who are more vulnerable, who very well could suffer a very bad consequence, be in the hospital, or even have death, but also for the broader community, because even unvaccinated people do get infected. Can we go to the next slide, please, James? This is the entire journey of cases in Kentucky. We show this on a regular basis, but it obscures what's happening in the far right. So if we can go to the next slide, James. This shows just the most recent 16 weeks. Now, this was interesting. It's purely coincidence, but interesting. Those bars on the far right are roughly the same numbers as we had this time last July, so a year ago. But the situation's totally different because we have vaccines now, we have PPE, we have treatments in the hospital. And now when we have those vaccines, we don't need to see this climb, because if we all got vaccinated, this climb wouldn't be happening like this. So now we have a weapon in our armamentarium that we can use to try to minimize this, but we've all got to get vaccinated. But that is more than a doubling in the last 3 weeks. All right, so I don't know if it's 2.5 times or more, but it's a substantial increase. Almost all of which, James, if we can go over to the next slide, you just saw this with me, 6-to-1 ratio happening in unvaccinated persons. It is too early for me to tell you the impact on mortality. We won't know how many people in these cohorts suffer death until 6 to 8 weeks from now. We've been through this before. It takes time for people to get infected, to then get sick and go in the hospital, to then unfortunately die from this disease, and then for it all to get reported through the layers of reporting. So we won't know until we get further along into August and beyond what the mortality impact of this is. But in places that are ahead of us in this journey, the mortality overwhelmingly, nearly exclusively, is in the unvaccinated population. Next slide, James. Look at this. This is July 1st on the left and July 16th on the right. We'll update it for today sometime between, well, about right now it should be updating on the website. But I had to use what I had from Friday. We had no red counties a little over 2 weeks ago, no red counties. We had 5 on Friday, and I suspect there'll be some more today than we had on Friday. And if you look at this, you can see how much more orange there is and that the green is diminishing. That's how quickly the map will change. All right, and you may remember we showed an animation of this earlier in the journey over a longer period of time, how the map transitioned from safer colors all the way to an entirely red and orange map, and then how it came back all the way down to this beautiful map on the left. We don't want that to all turn red again. But if it does turn red, what's going to end up happening is the unvaccinated are going to be the ones who take the brunt of this. They're the ones who get sick, the ones who end up in the hospital. Next slide, please. I just have a couple more and I'm finished. So this shows the United States on the left. It shows vaccination rates. On the right, it shows case rates for new people or people with new cases of COVID. This is on the CDC COVID tracker. It's all publicly available. If you're interested in data, I encourage you to look at that. There's a wealth of information. The example I'm going to use, and I qualify this, right? I'm sharing observations for real-time, large-scale epidemiology, and we will see if I'm accurate or not. But I'll share the observation I have here is New England. Hands down, the New England region in the Northeast has by far and away the highest vaccination rate of any region in the United States. Some states up there have 85% plus vaccination rates for their population. It's incredible. If you look, dark colors on the left are high vaccination rates, light colors on the right are low case rates. It's not likely to be coincidence. So many people are vaccinated in New England that it's suppressing probably the case rise on the right side. The flip of that is the South, from Texas to Florida, has lower vaccination rates. And if you look where the darker colors are for higher case rates on the right, that corresponds. Now that's not as obvious as the New England area because there's more uneven distribution in the South. But the trend is still similar. So we will see how this plays out, and over the months ahead, we'll look back and we'll be able to draw more meaningful conclusions. But right now, all the indicators would seem to suggest you want to be vaccinated because it is going to protect you from the worst harms of the disease. Next slide, please, James. I won't emphasize this too much, but the only reason I put up these titles for our clusters, it's the same stuff we've been saying the whole journey. When you get together and close to people in close proximity, people spread disease. We spread saliva, we spread mist in the air. We've all seen that. You're at a restaurant, and you're talking, and you spray a little bit. That's how we spread infection. Camps, daycares, churches, social events. When you're traveling, you're out at restaurants and things like that. It's when we're close together. It's agnostic to whether it is what the nature of the activity is. It's just the way we're interacting with each other. And so we've got to be very careful about these settings, particularly the unvaccinated and the vulnerable. Next slide, please. Is there one more in there, James? That's okay. The next one, I think, was just the recommendations from what the governor had. So these recommendations, just to emphasize this, everyone who is not vaccinated really should wear a mask when you're indoors around people you don't know, whose vaccination status you don't know, because your risk of getting Delta variant is much higher than the Alpha variant, which was the former British one, and the original virus. If you have pre-existing conditions, you're on immunocompromising medications, treatments are for cancer or rheumatologic conditions or the like, even if you are vaccinated, you should probably wear a mask because your immune response has been shown probably not to be as robust with the 2-dose vaccines or even the 1-dose vaccine. If you are in public-facing environments, remember this, it's about a volume of exposure, right? So if you're ringing a register and you have hundreds of people come in front of you every day, you have so many exposures, your likelihood of encountering someone with a very high viral load is much higher. If you're unvaccinated, you should definitely be wearing a mask then because your risk of getting infected is much higher. But you also should wear a mask to minimize your risk of transmitting to other people who are vulnerable. And then everybody should get vaccinated when you're eligible. And I remember, these are recommendations. This is a different journey we're on right now. Because of the vaccines, we all have a choice that can help protect us from this illness. I just strongly urge everyone to take that choice very seriously. If you have questions, ask your healthcare provider. If you're uncertain, ask your healthcare provider. Ask those doctors and those nurses that you entrust your regular medical care with what they would do. Please don't go to social media and other places for your medical advice. That is a bad route to go down. And this is something that is very preventable, and there's really no debate about this. The vaccines clearly work. They make a huge difference. You will be safer, and all of us will be safer if we all get vaccinated. Thank you very much, Governor.
Steve, you want to stay up here? We've got about 16 minutes before, or 17 minutes before a hard cutoff. And given that we will still have our Team Kentucky update on Thursday, I'd ask that people at least consider limiting questions to what we're talking about today. I'm going to go through and make sure those that registered have an opportunity, and I will endeavor to be brief in responses, though I always fail when I suggest I will. Karen.
We're about 5 weeks, give or take, from when most restrictions ended. In hindsight, do you wish you had waited? And are you close to implementing a mask mandate, especially with schools beginning to start?
So, no, I believe that the decisions we made, given conditions that were on the ground at the time, was the right decision. And the difference now between at any time before is people have a personal decision that they can make that protects them to a very significant degree. We also know so much more about the virus now. As far as schools, the Kentucky Department of Education has been very proactive, especially in the last couple weeks. And I think that there's going to be ongoing conversations with them. But I've been very encouraged from the commissioners to superintendents to the rest that people are taking this very seriously. I would say we talked about a sports team the other day. We really ought to think when we're thinking about schools about what our priorities are. If our number one priority is for kids to be able to be in every single day, we really ought to think about what we're going to do, especially with classes for kids that are under 12, since none of them can be vaccinated at the moment. One or the rest could cause a quarantine of the whole class multiple times. So we really need to how much we like the convenience of certain things. Or I will say that Lila Beshear, not old enough to be vaccinated in school, regardless of what the school says. for her that she agrees with. Lad.
Yeah, when you were talking about the cluster, 34 clusters, 335 cases, were those all?
So right now, we're not able to sequence the positive cases to be able to tell you all experts say is the vast majority of all of our cases. How quickly it has grown. Do you want to go over how quickly the percent?
So the national data second, it went from 3.1% to a little over 30%, about 31%, and plus percent when they released the most recent 2-week, tripling 3 weeks in a row. And in Kentucky, it happens weeks after the actual positive case. Estimate it's over 50% of what's in Kentucky at this to show that.
And the other changed. Now we're seeing clusters again. The change in all of these case numbers is the Delta variant. Tom Latek.
Thank you, Governor. End of this month, the eviction moratorium ends. A month after that, the pandemic unemployment ends. We also have the student loan freeze thawing, so to speak, and then also the food stamp expansion, et cetera, et cetera. How are you going to be able to wean Kentuckians away from these benefits that they'll be losing over the next couple of months?
Well, a number of federal programs are going to end either here in Kentucky and nationwide. Certainly, there is a lot of help that's out there. We still have a huge amount of money in our Team Kentucky Eviction Relief Fund that is there for every Kentuckian that has been struggling on their rent, and we still have a large amount of money out of it. The amount that we are sending out is increasing every week. We did over $2 million, 2.8, I think, last week, and that's a good sign. So there is still help there. Kentuckians need to know that the extra unemployment benefits are going to end. They are going to end at the latest, September the 6th. And you can't start your job search at that point. The answer to all of it, though, is getting vaccinated gives you the opportunity to be protected, to fully get back out in society, including getting back to work. And people need to take advantage of that. Chelsea Jones. Did we lose Chelsea? I think we did. Alex, Herald Leader.
So you said that the number of confirmed cases of the Delta variant is an undercount because you're not able to sequence them fast enough. How many has the state confirmed? And we saw the chart of the rising number of breakthrough cases in the last month. How many fully vaccinated Kentuckians, for example, have tested positive and been hospitalized?
Let us work on getting you that number. I've not seen the hospitalization number specifically. Do we have the total Delta variant numbers, Kelly? You pull that up? We can get you that one before we leave as they continue to be sequenced. Now, we continue to see a large amount of the UK variant as it comes through as well. But again, from everything that we're seeing nationally, we don't have any doubts or any reason to dispute that the Delta variant is now the dominant strain in Kentucky. Yeah.
Alex, one point on the hospitalization. So we often report cases, hospitalizations, and deaths. The hospitalization one is the hardest to get because we'd have to talk to every single person who tests positive who's a case to confirm do they go in the hospital or not. So they may go in the hospital for a day for observation and get released and go out, and we may never know. And so that one metric, and that's different than hospital capacity. The hospitals report every day how many people they have in the hospital who have COVID, who are in the hospital or on ICU or on vents. So when we release breakthrough data for hospitalizations, whether it's us or a local health department, I'd be very careful in interpreting that because it is guaranteed to be an underestimate. There are more people who go in the hospital that we never talk to and never know than we report for a short period of time usually.
So, as we've been talking about that, I think the numbers probably show serious illness a lot more than they show somebody who maybe sometimes an individual being careful can also be administered to can be admitted to the hospital for various reasons. Melissa, Kentucky Health News.
Why not require vaccinations of healthcare workers and long-term care providers, especially when a vaccine gets permanent licensure? Is that something you consider?
Well, certainly everybody in a healthcare setting should be vaccinated, but everybody in Kentucky who is eligible should be vaccinated. This is a no-brainer with the data that is out there, and absent misinformation that is pervasive and that is leading people to get less vaccinated against a lot of things. And this would be, again, it's a no-brainer. It protects you. The risks associated with the vaccine are tiny compared to the risks we face. Certainly, we have seen some businesses, some healthcare settings mandate it, and we're going to support each and every one of them that mandate it. And I think that they should consider that along their own in their own decision making as it applies to their workforce too, because it can be a real challenge. Certainly, long-term care, we need more people vaccinated. We also see a challenge that existed long before COVID on having enough workers in long-term care. A lot of that has to do with really difficult but really amazing work that we don't pay nearly enough for. But at this point, we don't think a mandate from state government would be effective and is not a step that we're taking. Do we have Isaiah Kim Martinez? Isaiah.
If I'm wrong, I mean, not a lot of these cases at this time are being run through tests to see if it is the variant or not, which leads to some of the undercounts. Where are we as far as percentage of them that are going on through testing to see if it is indeed Delta, and where will that go down the line?
I mean, a very small percent of all of our overall cases can be sequenced given what it takes to do that. Do we have an overall percentage?
In recent weeks, about 4.5% of the total number of positives.
So about 4.5% of the total number of positives go through the sequencing. So again, what we and what most other states have to do, unless they've got one of these giant labs that already existed in their state, is provide all of our information to the CDC and the federal experts, and then they're able to extrapolate that and push it back down. But it's the dominant variant in Kentucky. And you ought to assume that if you get COVID, it's going to be the Delta variant at this point. Do we have Piper with us today? I don't think we do. Ryan.
Thank you, Governor. A few quick questions here. Similar to Alex, I'm curious just the number of breakthrough cases, not hospitalizations, but just total number of breakthrough cases.
We'll get you that.
Okay, I'm curious about, you said this before, but I just want to hear a latest update. What percentage of the people who are being hospitalized are unvaccinated? And then finally, how many vaccinated deaths have we seen? And for the deaths that are related, or for people who have died of COVID-19 and have been vaccinated, how many of them are immunocompromised or elderly, that kind of thing?
So we can get everybody the numbers of, and we'll need a date that we move forward from when we would expect a certain number of people to be vaccinated, about how many positives we've had among vaccinated versus unvaccinated. We've shown that on graphs before.
Can I offer one clarification
Sure.
on this one? So for this, one of the things we're doing as we go through this, we are really going to try to adhere to releasing month-end data, which means like now on the 19th, was the 19th day, it's going to be through June 30th because
We can do June 30th.
yeah, so we can go through June 30th because the data set's bigger and the data's mature enough that we have more confidence in its accuracy. What I don't want to do is give the public inaccurate information and then have to revise it and create confusion. But that's why it'll only go through June 30th.
And I think what we have been seeing, and we showed the data for a period of time, is the vast majority of cases, and depending on how you look at it, in the 80% or in the 90% have been unvaccinated Kentuckians. Now, our overall number of cases are increasing, which means our total number of breakthrough cases is going to increase. But as we saw today on the graph that was put up, it's still much smaller, but we can get you the direct numbers. Anybody that's here that hadn't had the opportunity to ask a question that wants to? Okay, then I've got 5 more minutes, and we'll use them for anybody who has a follow-up. Karen and then Melissa.
Dr. Peck, is there any update on boosters that anyone needs to be aware of?
So the FDA and the CDC within the last 2 weeks issued a statement that the current evidence suggests that the vaccines are still sufficiently effective in preventing death and serious illness, that no booster is currently recommended. And they monitor that on a regular basis, and should that change, then they'll let us know. But right now, the most recent messaging on all the calls, even last week, was that a booster's not yet recommended.
Thank you.
And so the, early on, health officials use that 5% for positivity rate as sort of the number of concern. Like when it gets above 5%, we all need to sit up straighter and pay attention. Is that still the case with us, inching over that number right now?
Well, I'd say the increase in positivity rate is concerning. And certainly the Delta virus is concerning. But now we have the other factors that are involved. Some percentage of that are vaccinated and are therefore not likely to have a serious or significant outcome. We also have overall fewer cases than we've had at 5% at different periods of time. We have significant hospital capacity right now. And so, like before, all of these things work together. We've made some more serious recommendations today. We'll be watching the data to see what comes next. Alex and then Ryan.
With significant public exposure that you talk about, people should recommend wearing masks. What does that mean to you? Retail settings?
You know, we didn't drill down too deep because we want people to be able to make a bit of a personal evaluation of that as well. I would do it based on the number of people that you come in contact with every single day and perhaps how long it is. Certainly we'd recommend it for people in retail, for people in hospitality, but there's no question there are others that are there. If we went back 10 years ago, it'd probably be bank tellers, but now I'm not sure the last time I saw a bank teller. So if you think about those types of things, but I will say a lot of Kentuckians in these jobs are already doing that, which is a good thing. You go inside of a lot of restaurants right now, or at least certain types, and people are wearing masks, at least in many of them. So if you are coming into contact with a whole lot of people every day, it's something that you ought to consider. Ryan and then Tom, and then we'll have to wrap up.
Briefly, are we testing enough people? Are enough people getting tested for us to have a good idea of what's happening with the virus?
Well, I think that we are testing enough people to know where the trend is going. But I'm not sure that's an overall answer with certainty to your question. We'd like more people to get tested. A couple of challenges to that is that if you've got the vaccine, you may not ever show a symptom and thus never get tested. And that's a credit to the vaccine, but it's also a challenge to ask somebody to get tested that's been vaccinated and that is perfectly fine, at least outwardly. So it's another challenge in the data. I don't think it's any more challenging than issues that we faced. So we'll do Tom and Sarah if you have one more since everybody else has.
Okay, thank you. We have our counties that are in the red zone. Are your old red zone mandates still mandates? And what will it take for the rest of the state to turn recommendations into mandates?
So red zone recommendations are recommendations. We ought to look back at them with the Delta variant, and admittedly we haven't yet with everything that we've been doing, but we'll look at updating those. But it's really simple. Get vaccinated. Get vaccinated and your county turns green if you're vaccinated at a high enough degree. And what we see is if you're vaccinated and the county next to you gets vaccinated, you're in a safer area. I mean, right now in Franklin County, we're at 65% vaccinated, I think. Woodford County is 66. The protections offered by the people driving, back and forth, since obviously we all interact, they just grow. And so regionally, we want to see we want to see a lot more vaccinations everywhere. If you're under 40%, please. In your county, make sure that you're pushing extra hard to get people vaccinated. Sarah?
Will the state keep putting out on that dashboard the lowest 5, or will it just focus on anyone?
That's a good question. We've been putting out on vaccinations the top 5 vaccinated, the bottom 5 vaccinated. And again, with any data set, there are some issues there. Spencer County rightfully raises that they have a zip code that overlaps with Bullitt County, and they think that Bullitt County's been getting all their vaccinations. Now, we know that the county doesn't have enough individuals vaccinated overall, so we'll look, again, the Delta variant on the negative side, the vaccines on the positive side, about what data is most meaningful, and if you all want to offer your suggestions. We want to make sure that we're educating people as much as possible. And where we started on this journey was trying to get everyone the best information we could. Here, and then giving you all the best information to try to then analyze it, and if there are different thoughts, but to get it out to people. And what we've seen, especially in this last week with different things going on, is information, real information, factual information is absolutely critical to people making good decisions. So listen, we're willing to take all the difficult questions, but what we'd ask is just try to get people the fact, and the fact is, get vaccinated. You are much better protected, and we can defeat COVID. Thank you all. We'll have the Team Kentucky update on Thursday. A much smaller portion will be on COVID. Everybody get vaccinated.
Now, earlier we had heard somewhere between serious and critical. How much of a sigh of relief do you think this gives to see serious condition as opposed to critical?
Well, when you see the images of that vehicle, you're just glad that he's alive. I can't speak to the differences between those descriptions. Obviously, something less than critical is more encouraging than than that specific description. His agent, Mark Steinberg,